Okay, we will give you 6 excellent options for improving blood flow in your feet and your legs without exercise. And we're going to explain why exercise may not be an option, which is a realistic case in many cases.
Can I still exercise if I want to?
You bet you can. Always exercise. Therapists, we always advocate exercises. But we're going to get into that in a little bit. Wait 9.3 seconds and we'll get right at it.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, here we are. As therapists, we're talking about circulation in the legs, how to get the blood flow better. As a therapist, we almost always recommend some form of exercise or repositioning of your body to get gravity to assist. However, there are 3 problems that can cause with different populations, different people. Number 1, there are some people who just absolutely refuse to exercise. If you're a therapist, you know those people because it's pretty obvious. Sometimes they just come out and tell you, I am not going to exercise. And I say, thank you for your honesty, and it helps me guide do treatment that doesn't include exercise. Mike?
Other cases are people with severe dementia or memory loss. They do not remember to do the exercises. They do not remember they have poor swelling. Sometimes they don't know who you are, so they're not going to remember. So these are some options you can try as well with them.
That's right. And of course, there are certain people who may have work challenges where they're at work sitting. It's hard to exercise. They're just busy people. And exercise just doesn't fit into their day very well, but these will, and without problem. So let's get on with it.
Option number 1 is elevate your legs for at least 30 minutes a day. You can do it laying down like I am, or you can do it in a recliner if it goes back far enough. I have a leg wedge here. You can purchase one, or you can simply just use some pillows. The goal is to get your feet elevated above your heart to help with that swelling and get the circulation flowing better throughout your body.
Right, and this is very nice to do. One thing, if you are in a recliner, and the recliner, oftentimes the legs won't go up high enough in some recliners. So again, add a couple pillows onto the leg part right underneath the calves, and so the pressure is spread out very nicely, and it'll work very well. The second one, now this is a really nice option, especially if you're up and about or you're sitting at work for a long time in front of a workstation, computer workstation, whatever it may be, compression socks, okay? Mike has 2 different options here. Here we've got a pair. Make sure they go not above the knee. Make sure they have more compression. It's in millimeters of mercury, like 15 millimeters of mercury around the ankle. And they'll give this in the description. And then 20 here is a really popular, very common specs for this. Okay, so wear those throughout the day. Do not wear them to bed. Now, if you have severe swelling or you have usually typically older people use this. I know my mother does. Where I've worked with a lot of patients in the geriatric community, and it's using what we call tuba grip. So here you can see the toes are cut off, and that's because it's called tuba grip because it comes in a long, whoa, like that, and we cut it so the length is right at the toes. Right at the toe line here, at the knuckles of the toes, if you will, and then below the knee, and you slide those on. They don't have the compressive gradient where it's tighter here than here, but they work quite well, particularly in the population I described. You can, if they roll down, like on this, if they tend to roll like this, it's called a tourniquet. Usually happens here, but I've already put on the Coban tape, which does not stick to your skin, but it does stick to itself, and that can prevent it. Usually you don't need to use that. I just have that on if you do have that problem. Works very nicely for that population. So that's it. Compression garments, again, wear throughout the day, not throughout the evening or sleeping.
Another way to get circulation going throughout your body and your feet especially is just massage. So you could start on the bottom of your feet and just dig in with your thumbs. Make sure to move all around what feels good. Obviously, I'm in what they call a figure 4 position, so I can reach my feet. If you can't reach your feet, You might have to have someone like Brad massage them for you then.
Yeah, or do the another option. The other nice thing about this position, Mike, is that it's elevated. So you got gravity working the fluids and the blood going downhill along with massage. And it's important you start on the feet, spend about a minute or so on that, and then work to the calf, working that calf belly like Mike is doing right now. And we're just getting that blood moving in any areas where it's pocketing, if you will, moving in the right direction. And you're probably going to spend 3 to 5 minutes. And what's going to happen that's going to limit you is your hands are going to get tired.
Yes.
So if you do one leg at a time, if you do both legs, you'll figure out quickly how much time you can do this before your hands fatigue and it becomes uncomfortable. So you don't want to get problems and itises in your fingers and your knuckles and whatnot.
Yes, and this is not really like a good option for severe edema. That type of massaging is a little different. So.
Right. Particularly if you have pitting edema. If you have edema, you know what I mean, where you push your thumb in and then you take it off and a dent stays in that area. That's called pitting edema. This would not be for that situation. All right, we're carrying on number 4. All right, the next option is, again, another massage, but instead of getting sore hands and fingers like I mentioned previously, if you happen to have a massage gun, that can be a great way to get circulation moving, relax the muscles, etc. So here we have a gun. This is our
T2.
C2, like cat.
T2.
T2, like Tom 2. Okay, T2. And the head that I like to use for this, like Mike shows, is the round head. There are other heads. There's the bullet head. There's the air head. Not like me. But anyways, the round head I think is the best, and we'll go why. We'll demonstrate why. Now, here we go. Mike, supine position again. So gravity assists with the blood flow going down is a big advantage, and it's real comfortable. This is the way I like to massage my legs, particularly
Yes,
lying
feels
down.
Nice.
Yeah. Make sure the massage should feel good. If it's too aggressive, there's 5 settings on this particular gun. Slow it down a little bit so it's not so aggressive.
I'm just on number 1 on the bottom of my feet, and this is going to be less aggressive going lateral versus directly into it. So.
Right. Move the ground, and that's the big advantage of the round head. It allows you to change the angle, which then in turn changes the intensity of the massage. Should feel good, very relaxing. Again, start at the feet, work down to the muscle belly of the calf. So the blood is going with gravity and the percussion of the gun, making it go down proximal to the core and into the system. How you doing, Mike?
I'm good. When you said Airhead, it reminded me of that old movie Airheads. You've probably never seen it. Brendan Fraser and Adam Sandler?
Yeah, I've heard of Adam Sandler.
I think Adam Sandler's in it.
Does he play golf?
That's Happy Gilmore.
Oh, yeah, Happy Gilmore. That's the one I was thinking of. So again, working the quadriceps. These are large muscles. There's a lot of blood involved in these muscles. So we need to get the fluid moving down, and that'll actually open up the pathways for circulation from the feet and the calves.
Should we go on to the next option?
Absolutely. And this, your hands don't wear out. You can spend 5 minutes very happily doing this, by the way.
That's very easy.
And feels good. Yet another option to get that blood flow moving in the legs and proximal where you want it to go is the foam roller.
Yes.
This does take a more able-bodied person. It's a little more effort to do. They work quite well, however, just a little difficult, and you'll see why. You also probably want to get the foam roller that's not so dense. It actually squishes in. It's a little more comfortable. But some people like the black ones are more denser, the densest one they make, and that does get into the muscle and actually massages the muscle more aggressively. That's your choice. So Mike's starting. Again, we're going to start on the feet, lying supine. Go ahead, Mike. Tell them what you're doing.
I want to get a little more aggressive with this. I could lift my butt off. It takes a little more balance and coordination to do that. Also works your hamstrings quite a bit. And it's just digging in down my plantar fascia area, really massaging in, and just start here and work your way up. I can go up to my calves pretty easy. You can do double, single, whichever you prefer. I do single a lot. I don't know what you do.
I usually do doubles because it gets done faster. But if you have one side that's tighter than the other. Maybe you got a knot in there. You'll want to go on that one side single like this.
My foam roller is half the length, so that's probably why I do one.
Sure.
And
Yeah.
you can also turn your toes out and turn them in. It works different areas of the calf when you do that.
Yeah.
This is usually where I feel it the most. I like an aggressive one. Mine has actual little nodules in it.
Oh, yes.
But that's just me. Pick what one you prefer and what works best for you. Brad, are you going to show the...
Yep, anterior tib, the muscle here. You just have to flip over. I'm going to do it for Mike so he doesn't have to bounce around so much on the floor. And you just simply go like this, turn sideways. Feels great, actually. It's a nice massage. You're getting that blood flow moving. And then up to the hamstrings.
hamstring. So we're back on this side. And just go from your buttock to the back of your knee. Keep your leg straight. You can do single leg, or you can do double leg if you want. Takes a little more balance with both. And it feels pretty good, personally.
Yeah. Yep. And again, you can kind of roll side to side with this. The quads, you need to go prone, stomach down. And this is the way I work that. So I go back and forth. And I always go on my side a little bit, do one leg at a time so I get those lateral quadriceps, both sides. You're probably going to spend about 15 to 30 seconds on each one of these groups as you work up. And they can get all the way into the glute muscles as well.
Yeah, you can massage the glute on here. I like to kind of figure four, personally, and kind of roll around in different positions. But that's just me. That's why I feel it more.
Sure.
So my buttock itself is fine, but I can feel a little bit of my pure formers when I do this.
You know, I would say this is kind of optional when you get up into the glutes. You already got the leg, the ankles, the legs pretty well massaged, but
Yep.
you're doing it, you might as well be complete and get the muscle groups all the way up to the hips. Yeah, you feel much better, Mike?
Yeah, are we going to get on to option 6?
Oh, yeah, but we're going to take a break.
Oh, okay.
All right, short break. Number 6. This is probably the most desired way to get circulation going in your legs. It is for me, and that's simply hire a massage therapist. They're excellent at their job. They'll get the muscles loose. They'll move the blood flow in the right direction because that's what they do, and they're experts at it. The big thing is it costs money, and you got to do it. That's why I never use them.
Yeah,
It's a treat. You know, if I'm going to get one, it's going to be a treat. But some people might be able to afford it. Go for it.
if you got the money, go ahead. It's probably the best option, I would say.
Yeah.
But also self-sufficiency is good, too.
Yeah. All right. Very good with that circulation in your legs. It's going to get better. You're going to feel better. Next thing you know, be dancing like Fred Astaire.
What if I couldn't dance before?
Well, you will be able to after
Oh,
this.
okay.